Good morning. I'm Mike Smith, Secretary of the Vermont Agency of Human Services. It is my pleasure to welcome you to the Vermont Suicide Prevention Symposium. I know a lot of us have been challenged through the COVID pandemic. Some of you are juggling work with caring for your families and adapting to new social norms and health risks everywhere you go. These are not easy times for any of us, which is why we must keep coming together in new ways to support one another and to shape a better tomorrow for everyone. The loss of life by suicide has incredible ripple effects throughout families and communities, increasing risks for all of those touched by the loss. And we know that Vermont suicide death rates are higher than the average U.S. rate and increasing faster than U.S. rates in recent years. I want to take this opportunity to share an update on what we at AHS are doing to protect Vermonters. In the past 10 years, Vermont has demonstrated national leadership in healthcare reform. With our shift towards a value-based model, we created efficiencies and defined performance measures for providers that align our efforts and utilize data to inform our decisions. We have strengthened resilience across the state with evidence-based initiatives like building flourishing communities, zero suicide, and the Success Beyond 6 program for school-aged youth. I am so proud that in nearly 40% of Vermont schools, every staff member is trained in trauma-informed practices. More than half of Vermont schools and a majority of our high schools have participated in You Matter Suicide Prevention, a national best practice program developed here in Vermont. As we prepare to return to school, it's more important than ever to make time to check in with our youth on a regular basis and to be sure they are familiar with how to use the crisis text line. And we must check in on our teachers, our staff, our school staff, parents, and each other as we all develop and adapt to the new way of managing life and our responsibility to maintain the social fabric that has made Vermont strong. Vermont continues to move forward toward a more integrated system of care, one that is affordable, high quality, and that improves our overall health. Recent legislation creating the Mental Health Integration Council, which is charged with overseeing the implementation of the DMH 10-year plan, is our response to the input from hundreds of Vermonters about what they want and need in a healthcare system. The Council will be reviewing and prioritizing the short, mid, and long-term goals put forth in the report and will facilitate connections that allow us to achieve those goals swiftly, affordably, and equitably. Our Department of Mental Health is continuing to pave the way with efforts to support and expand a best-in-class workforce that is trained in evidence-based practices that effectively address suicide. As part of our move towards integrated and holistic care, AHS also supports universal screening and identification efforts broadly across our entire healthcare system to better identify those at risk and refer them to the appropriate qualified mental health support. Suicide affects not only the people in our care, our communities, and our neighbors, but the staff and colleagues at AHS, which is why we have worked hard to prioritize suicide prevention policy for our own staff. to assist us in identifying risk factors and ensure they know how to respond if someone appears to be at risk. I encourage other leaders and employers to do the same thing with your staff. Don't hesitate to show that you care about their mental health. As a state, we need to address stigma around seeking help, especially with men who are dying by suicide in disproportionate numbers across the nation and in Vermont. AHS has recently scaled up efforts to communicate to every Vermonter that suicide is preventable and help is available. So I would just remind each of you to do the difficult work that lies ahead. Remember that your joining us here today is going to give so many others hope, and it will have a positive and lasting ripple effect. I want to close by saying thank you again for the work you all do every day to support a resilient Vermont. I know that we have some incredible speakers and conversations planned for today that will do so much to inform how we move forward together. Thank you and have a great day.